Hello, my name is Dr. Becky Turpin, and I am the Director of Compliance and Student Support for Nursing Programs at Appalachian State. This orientation for compliance requirements is being provided for students in the graduate program in fall of 2024. I would like to welcome every one of you to our combined journey for attaining and maintaining compliance. We welcome all of you as new students to our programs, whether you be in the graduate certificate program or pursuing your Master's of Nursing education. In our Master's program, the majority of the requirements that we have are based on hospitals, clinical, and educational agency requirements. So it's important to note that as you come into the master's program or the certificate program, you have to attain the compliance that's required for the programs that you're in, and keep that ongoingly up throughout your time with us. You will have several requirements that need to be addressed at different times during the year, so pay real close attention to due dates that come up in what we call the Complio system. That is a software system from American Data Bank out in Denver, Colorado. And you will get more information as we go through this of how you're going to do this. One of your main guides that you want to use to become compliant is the Nursing Student Compliance Checklist. It is available in the As You Learn Graduate Nursing project site that we'll talk about. It is also, if you go to the Students tab on the Department of Nursing website, on the far right side of the students page are a lot of different forms and things related to compliance, and there's actually a link directly there to the Nursing Student Compliance Checklist. The checklist is a good, detailed oriented document that is meant to be used for you to kind of go through and evaluate right now as you enter the program what types of documentation, forms, different vaccination records, education records, lots of different things that are going to be required for you to be beginning right away to pull and save into either scanned documents or PDFs that are uploadable to the compliance system. So your first point is to pull that compliance checklist, start looking over and figuring out what documents do you already have available and what documents do you need to reach out to previous schools, your doctor's office, different things to begin that journey of compiling everything. Beyond all that work, it's important also to note that compliance is not just items that go in Complio. It also means that you have to apply by the policies of the department and of the university, keep your grades, or GPA if there's certain requirements for the degree that you're obtaining in line, meeting course participation and timely completion of assignments, meeting practicum expectations as you're going through those courses. It typically is going to involve more paperwork and requirements for when you get to the level of doing practica, whether that's in clinical practicum or educational practicums, and then following all infection prevention rules related to being in those agencies or with those preceptors, and then general good teamwork behavior, civility, collegiality kinds of mindset, not only in person but in online learning environments with both classmates and faculty. There's important dates to remember going forward, so be thinking about this well in advance. You cannot turn everything in by October 31st and think that it's all going to be just happen. So that's why you need to begin working on those. You are going to have a nursing student physical exam. There is some additional documents that you will need to take with you to the doctor. You have to use the forms that I'm going to tell you about with some of these things that are in there that are required. So you can't just go get your last physical exam from the doctor and insert that. The physical exam for coming into our program has to include all the elements that you would have to be examined for, specific to our form for physical exams. And then there are several other forms that in the Complio system you will electronically sign that saves a little bit of time on a few of them. Again, use the nursing student checklist to really make sure you've got everything, and allow yourself plenty of time before October 31st to upload all the items. The Complio reviewers will look at these things as they come in. It may take the company 4 to 5 days to accept information that you have inputted. So you really need to try to strive for trying to get everything in by the middle of October, just so there's a buffer of time in case something's not dated right, or you forgot to put a name somewhere, so that you allow a little time for them to review, give you feedback, and if there's anything to be edited so that it can be fixed and approved in plenty of time. So Complio, as I mentioned, is a system that we use to really meet all of our needs, not just for your records, but for background checks, drug testing, and then all immunization and educational records. Each student is required to place an order for their own account, and it is based on the time that you're going to be in the program in terms of the fee. For a 2-year fee, which is the usual for a MSN education coursework, you would do all select the bundle that includes, for the MSN program, background check, a 13-panel drug screen, which actually I believe in the system says 12 plus fentanyl, so you know you've selected the right one, and then the compliance tracker, which is what organizes all your records around and keeps track of the dates. This for 2 years has been a fee of $148. I have not heard of an increase in fee, but it should be close to that amount. So you will not go get a background check from somewhere else. It will run one in the system. It also is usually a little different than just a general background check that may have done for you to get into the university, because it has to include all of those checks, not just for crimes related to non-healthcare related crimes, but it also runs like an OIG check or Office of Inspector General check that's required by clinical agencies that are working with nursing students of all types and other health professionals. So those are the 3 elements that are going to be part of your order. You can order and make your account, but if it's not a paid for account, it can't really have any availability for me to see how it's progressing. So, and it usually is not going to let you do anything or run anything. So make sure that when you get ready to do it, you already kind of have the idea of how much it's going to cost and have the ability to go ahead and pay for the account. These are some of the key elements that you're going to have to complete as part of the compliance requirements. There is a physical exam and safety and technical standards. There's TB testing that's required initially and annually, immunizations, criminal background check and drug screen, forms and training records. So we're going to hit the highlights of those. So for physical exam and safety and technical standards, these are two separate forms that are required by our department. So you have to physically print these off and take these with you to your physician's appointment. Your physical form has got sections in there that deal with eyesight that must be done, which may not be always common at every visit for a doctor's office. So you need to make sure when you're setting up your appointment that you're making sure they understand that this is a full physical assessment, including an eye exam. It also includes a eye exam for color blindness. If for some reason your physician is not able to do those kinds of eye exams, then you may have to take the form additionally to get your eye physician to do those exams. Most people would have had an Ishikara color blindness test done at their employment on hire, so there might also be a record of that could be attached. So there are just some different options, but just to realize the expectation is you're getting all of the detail that is required for that form, and it must be signed by your medical provider as having been reviewed at the time of the physical exam. The safety and technical standards evaluation is a separate form. You will actually go through and evaluate your ability to meet the cognitive, affective, and psychomotor requirements of the nursing curriculum. This is developed in conjunction with the Office of Disability Resources, and so it has to be completed during your health provider appointment. You will fill out your assessment of that, whether you need assistance or if you're able to meet the requirements in each of those categories. And then you will take that to the doctor's appointment. They'll look at your answers to those questions, ask for any clarification, if there's any special things that need accommodations, and then they will sign off on having reviewed that with you in light of your physical exam and other things that you might discuss as part of the physical exam session. This document has to be done also annually. The physical exam is only done initially on coming into the program, but safety and technical standards is evaluated again every year. And so you're going to have to keep that in mind when that comes up, to have that re-reviewed, fill it out again. Usually for a second visit, if it's with like a primary care provider that is you're well known to, you may be able to just say to them, I don't know if I really need to see a doctor, but I've redone the form, and whether that's a discussion with the nurse over the phone that nothing really has changed with your health, and then they get a provider to sign off on it. Sometimes that might not incur a separate physician actual assessment or visit. Next thing is TB testing. TB testing is required, and you'll need to get a 2-step PPD skin test at the beginning of the program. And what that means is you get a test placed that is read within 48 to 72 hours by a signing provider. Then you get test 2 done 7 to 21 days from the first PPD. Then you go back and you get that read again at 48 to 72 hours. Some places are able to do this with your employer. If it's needed outside of that, you can certainly get that done elsewhere. But you have to realize that is 4 trips somewhere for placement, reading, then scheduling another time to go in and get it placed again, and then reading. So another thing that people may consider is, what is the best use of my time? In lieu of two-step, you can get an annual blood test, which is a QuantiFERON Gold or a T-Spot. And those are a little more expensive. They may be about $60, depending on your insurance or what your provider will provide or what your employer will provide. But that might be to your benefit in some cases because you don't have the flexibility of time to go back and forth 4 times to get the two-step PPD. Either way, annually, after that, you are able to either get a blood test annually, or you can get a one-step PPD. These are a list of all the immunizations that are required by the program. You have to have MMR 2 doses in your childhood, or you have to have records of having a positive blood test showing that you're immune to measles, mumps, and rubella. And usually if you're getting a titer for that, it is not a combined 1 titer, it's actually 3 titers, 1 for each disease. For DPT and Tdap, you have got to have you should have had 3 doses in childhood, and you should have had a Tdap that was done by 2005 or later, and you must have a booster in the last 10 years. So really, you'll need to look at your immunization records just to see, have I had a Tdap or have I had a TD in the last 10 years, then you should be okay with that one. In terms of varicella, most people will have had 2 varicella vaccines in childhood. If for some reason you didn't, or you can't locate those, you'll have to have blood drawn to establish that you have a positive titer for immunity. And then hepatitis B, most students that are working nurses have likely had a titer. Most of them have had hepatitis B 3 vaccines given to you earlier in your career or as a child in school. And so it's getting those 3 doses. So to meet this requirement, you have to have the 3 doses, plus you have to have a blood test showing that you are positive for immunity. It does not have to be a blood test that was done right now. You may go to your employer and find that you have had that on being hired, and you can use that titer. You just have to have 1 titer and the 3 doses, regardless of how long ago it's been. If for some reason you have no interest in getting revaccinated, maybe you didn't have a titer result and you went and got one drawn and it comes back that you need to get more vaccines and you would just prefer not to go through all that process, we do have a hepatitis B declination form that you can sign instead of going through further work with that. And I'm usually happy to work with people on details about that. So just let me know what questions that you do have. Other immunizations that are required, we do require flu vaccination each October from October 1 through 25. So just realize that you don't want to be too close to the end of October 25. Is about the limit on when you can get that in there and get that uploaded. You must use our app state form for this. You may go to your doctor or you may go to your pharmacy and get a flu vaccine, but you have to take the app state form with you. Occasionally, I've had a pharmacy say, oh, no, you don't really need that. Do not listen to them. You do need to use our form. The main reason for that is we are required to report all the key elements related to flu vaccine, like lot number, expiration date, and all those kinds of things to the state. And so, just a printout of a prescription at the pharmacy without that specific detail will not meet your compliance requirements. Currently, most all agencies have pretty much foregone the COVID vaccinations, or they're no longer mandating boosters. Something could change with that down the road. So, of course, we would keep you informed if some other thing became required again for that. The last piece of this relates to the criminal background check and drug screen. If for some reason during the background check, there's some issue that is determined that's a problem, those are, those findings will be taken to the chair of the department. They will discuss those findings and come back with any requirements that must be done to clear the student. If there is one that is cleared by the department, by the chair, that might still mean that there's some difficulties with clinical placement for practicum or for education, and it might limit the locations that you could be placed for certain things. And we would just work through however we need to deal with that. Because clinical agencies, they make their own decisions on what they will accept versus not accept. In terms of the drug screen, the department really has a no tolerance policy regarding substance abuse. They can do an at-cause, check if they need to. That would be uncommon mostly with our online students. But, sometimes people have accidents or injuries or something that come up in the course of doing some clinical practica, and they can require that should there be an issue with that. So just if there's a identified concern, then someone would talk with you about that, and often I would be working with whomever that is directly. The drug screen must be through our compliance vendor, Complio, to ensure the chain of custody. The drug screen location is chosen as part of the drug screen order when you're placing your order in Complio for your compliance system order or your account. And usually they use LabCorp or Quest, and I believe in the system it gives you the option to locate a site where you put in a zip code, and it helps you determine which site you would prefer to go to, and you can go ahead and set up the appointment with that through that system. Be sure to take the following items with you when you go. You need to have some receipt of payment, if that's a screenshot of your order or your compliance account. They need to know when you are going that this is not just a walk-in drug screen appointment. They need to know this is a Complio appointment, because there's been a couple times in the last few years where students did not make that clear when they went to the appointment, and someone went ahead with the drug screen and had it logged in their system just as a general one instead of one that is tied to your Complio payment and order. And if they do it the other way, they can't redo it, is what I've heard from LabCorp. So that means you have to set up another appointment and come a totally separate day and redo it, because they will not do two on the same day. So just avoid that altogether and make sure you at least have a screenshot of your Complio. And when you go in there to register in, make sure they emphasize this is for, a Complio drug screen. You also will need to take a picture ID as you would to any drug screen test. In terms of training records and forms, the As You Learn graduate project site is going to have a HIPAA training and a little quick computerized quiz. Same thing for bloodborne pathogens and a little quiz. You have to make 90% on both of those exams to be finished. And you will print out a PDF copy with your name on it and your banner ID to be able to upload those for approval into the system. Also on the graduate project side is the bloodborne pathogen, is the North Carolina AHEC core orientation and certificate. So you'll see a link to go to the core orientation. You go in there and you do this core orientation training session on their site. And at the end of it, you'll have the option for printing off a certificate, putting in your name and your completion date, and you'll upload that to Complio. But make sure that when you're putting your name in there on that certificate, beside it, you're putting your banner ID. A bunch of folks have to recognize they have people with the same names of all kinds of things, and even in some programs, people with the same names. So they will not accept any documents that don't have your banner ID on it. If you're interested in looking at any of the forms, I've provided a link. You can go to the PowerPoint that's in the As You Learn graduate project site, and you can click directly through to the students page that way, or you can just go on our website and see the student tab. But any of the forms that you might need for compliance are there. Even though there's a hard copy of some signature forms, like a student information form, that is one that you can get. You can also, in the Complio system, get a copy of the forms as well. So it's a variety of ways you can get to these to get these done. And there's some forms that are just a signature kind of form and those will be in Complio just where you do an electronic signature. So even though there's a hard copy of the actual form, it's also kind of set up already where you don't have to do a lot of, downloading and signing and then uploading back. You can just electronically sign it there at the Complio account site. For your RN license and your BLS, both of those are required. The RN license has to stay in good standing and maintained through the program. You will have to upload a license verification from the Board of Nursing. If there's any renewal that occurs during the time, it's going to notify you that you need to do a renewal before it expires. So you need to keep that up to date with a new verification if you've renewed your license. Also, for BLS, you must have the American Heart Association BLS, usually considered the Heart Code, one that includes CPR and AED training, which is pretty much the norm for most hospital and healthcare nurses. If you are local, our College of Health Sciences has an affiliation with IHHS, and there is a method, if you're here in Boone, that you could technically take an online course and get checked off here in our building if need be. Again, American Heart Association BLS is required, so you'll need to have that. If for some reason you have an employer that does not require American Heart Association BLS, you can always reach out to the director of the graduate program with some details about that if that's something that you want to see if they can override or approve. It also is important to note that even if your employer does say they only use American Red Cross, and that's what your certification is, that might be okay to have, that approved for the program. But if you're going to do any clinical practicum or educational practicum, The vast majority of all of those sites that you might use are going to require American Heart Association, and they are not going to override that. So, of course, if you have questions about that, reach out to me directly, and I'll be glad to help you navigate that. So, access, how do you get the Complio account? The access to that is in the Graduate Nursing As You Learn site. So here are the instructions on how do you set up your Complio account. First, you're going to need to access the Graduate Nursing As You Learn project site. So this is just a few little steps of how to get there. Since this recording is loaded on that site, it's probably you're already going to be there, but in case you forget because you've not been in there in a while, look at the PowerPoint or keep a record of these little short instructions, because sometimes people get ready to go back in there to do an annual retraining or something, and they're like, I forgot how I get to there. So this is a good slide to keep handy, the details on how to get back in there later on if you need to. But anyway, this is sort of how you get there, and you'll kind of see what you're doing, because everything is in there that you need. Lots of videos that explain how to work within Complio, and tips on ways to make sure you're uploading the right things when you're uploading documents and that kind of thing. This is another good slide that has a lot of reminders, with what you're uploading to Complio. Is it a legible document? Do you have your banner ID on the document? Is it something that's coming from your school so they know it really is the right person? Are you using a provider form instead of an ASU required form? So just kind of think about that. Do I have the right forms before I go to the doctor? And then when I get ready to upload it, it's okay if you have extra things to attach, but you can't take a physical exam that has a whole bunch of requirements on it and just say, see attached. That's not going to work. So just be aware of that. Do you have an actual provider signature? Does it say MD, NP? Is that legible? Can you tell? Does it have a stamp or something that really shows what office and follow-up number that someone could get in touch with a provider at? Or is the page totally not readable? Sometimes we take screenshots of things and they're just not clear when you try to enlarge them to look at them. So make sure that if it really needs to meet those requirements. And again, just, common compliance problems, things that come up with immunizations or exams are listed there. I will say there is an additional program. This does not apply to everybody, so don't worry about this unless it does apply to you when you get ready to do clinical practicum. It can also apply to you if you are going with one of our educators in to do some clinical teaching practicum, or you're precepting with a master's prepared educator in a hospital setting or healthcare setting for some type of educational practicum hours. If you're going into an Atrium Health, a Novant Health, or a Caramount Health, and there are some others because multiple ones are beginning to use this system across the state, it's called My Clinical Exchange. You have to have an account with them to go into those agencies. The max for this would be 24 months at $79, but typically you can just have it active. You can just do it like for one semester, and it's like maybe $25 or $35 just for a short period of time when you're doing this. But if you have approached me and let me know like the sites you're going to or the preceptors that you're planning on using, then I will be letting you know if you're going to have to be required to have this account as well. The nice thing is it does both compliance and your placement for the experience you're going to be with and who your preceptor is going to be. But it also is interfaced with Complio. And so you don't have to upload 100 documents all again. You just can tell the system to pull that information from the linked Complio account. So this was something that won't happen and you won't need to know about right away, but just because I want to be, transparent, there can be additional fees for agencies, and this is one of the ones that we see fairly commonly. Some of the people who are out on the eastern part of the state also use a system called Rotation Manager that is fairly common, that there's fees associated with that as well. And so there might be, depending on the agency you're going to, some other type of program. And I will say that this is, often people believe that, oh, I work, for example, myself, I work at Atrium Health part-time. So if I was to go to a student, I'm an employee, I wouldn't have to have this because they have all my records. And there is nothing further from the truth. They do not. You're doing one thing for pay in one entity and you're doing something totally different when you're in the student role. So, and that's their requirements, okay? Not what we're imposing. So you would have to have an account even if you are an employee already of one of those agencies. You may have additional questions in the As You Learn Graduate Nursing Project site. There is a Ask the Compliance Director forum. If you have questions about anything related to compliance, you can email me directly, but it's often nice if it's a general question that it gets posted there, because if you're having questions about it, probably some other students in the class are having questions about it as well. I would safeguard one item about that. If you have personal medical questions about anything, you should not post that kind of HIPAA protected information or questions about those items in the Ask the Compliance Director section, because then every other student can see what you're having your medical information questions about, because that is not secure and it is where other students can see it. So in those cases, it's best to email me directly, and my email address is turpinrl@appstate.edu. So, and if for some reason you have trouble finding this, you can always go to the faculty directory on our website and you can see my contact information there as well. Thanks for your attention today. I appreciate your time, and I'm happy to work with you as you begin our journey together.